discussion of the middle ear. Here you can see this is the external ear on the both sides. This is the anterior end or frontal end. This is the occipital end or it is a posterior end. Here you can see this is a foramen magnum, and this is the spinal cord. You can see this one is a vertebral artery, and here you can see this one is the interjugular foramen. We have cut it, and here this is the internal acoustic meatus. There is a two nerve, facial and vestibulocochlear nerve, which is enter inside. Now we will discuss about the boundaries of the middle ear. Here you can see this is the incus, which is connected with the malleus. You can see this is the malleus, and here this one is the tympanic membrane. Now we will discuss about the middle ear. This one is the external ear on the lateral side. You can see this is the lateral boundary which is formed by the tympanic membrane. Here you can see this is the lateral boundary which is formed by the tympanic membrane. We have cut and reflect the tegment tympani roof. We have already reflected. It is formed by the temporal bone. It is the tegment tympani. We have removed it, and posteriorly the middle ear. This is the posterior part of the middle ear. Here you can see this is a facial nerve. This facial nerve, this is a facial nerve, you can see, and it goes posteriorly. Here there is a genicular ganglion. So this facial nerve, which makes the posterior boundary, vertical part of the facial nerve. This is the vertical part which is goes straight, and above it there is a mastoid antrum which is connected with the mastoid process, adductus to antrum. It is inside there is a mastoid air cells. So this one is the posterior boundary which is formed by the mastoid air cells, and it is connected by the mastoid adductus to antrum, and vertical below the vertical part of the facial nerve. This is the vertical part of the this is the oblique part, and the canal inside the stylomastoid foramen. The canal, it is the vertical part of the facial nerve. Now the floor, here you can see this is the groove for the sigmoid sinus, and it is come out the sigmoid sinus. This is the interjugular foramen. Here you can see this is the cranial part of the spinal accessory. This is the 9th and 10th cranial nerve. You can see it is the glossopharyngeal and vagus, all three nerves along with it. Here the this sigmoid sinus, which is continues as a interjugular vein, which makes the floor of the middle ear. So the interjugular vein which makes the floor, which is separated by the thin plate of the bone. It is the petrous part of the temporal bone. So the floor which is formed by the interjugular vein, which is separated by the petrous part of the temporal bone. Now the anteriorly, here you can see this is the anterior boundary. We have reflect the partly the bony part. Here most anteriorly, it is the lower part. Most anteriorly there is a intercarotid artery. This is the intercarotid artery, and above to it there is a groove for the pharyngotympanic tube. It is connected inside the nasopharynx by the opening of the internal auditory meatus. It is a pharyngotympanic tube, but it was not properly seen, or it because of lack of instrument we will not to save it. And the most upper part there is a tensor tympani muscles. All three which makes the anterior boundary, most upper part tensor tympani, then pharyngotympanic tube, and lower part it is by the intercarotid artery. The medial wall, we have removed the this is the cochlea. This is the basal turn of the cochlea, bony cochlea. We have removed its from the medial wall here. So it is called the promontory. It is the first basal turn, and the above to it, this is the long process of incus. Here you can see this is the long process of incus, which is connected with the stapes I will show you the stapes. Here you can see this is the stapes, very small bone, which close the oval window, which lies posterior to the basal turn of the cochlea promontory, and above to it, here you can see this, above to it there is a oblique part of the facial nerve. Here you can see this facial nerve which is connected, it goes posteriorly, and this oblique part of the facial nerve lies inside the medial wall also, and above to it we have already cut the lateral semicircular canal. So medial wall, which is formed by the basal turn of the cochlea, I already show you, this is a basal turn of the cochlea. Above to it there is a oval window which is closed by the stapes muscles, stapes bone, and above to it there is a oblique part of the facial nerve, and then above to it there is a lateral semicircular canal. This is about to the medial wall of the middle ear. Now we will discuss about we already discussed the lateral wall. It is formed by the tympanic membrane. Posterior wall, it is formed by the vertical part of the facial nerve, and above it is adductus to antrum. We have removed it. Floor, which is also formed by the petrous part of temporal bone, which separates the interjugular vein. Here you can see this is the sigmoid sinus, which is open inside the interjugular foramen, and it becomes continuous as a interjugular vein. And you can see this is a cranial part of accessory nerve 9, and it is the 11th nerve, and 9th and 10th nerve, it is a glossopharyngeal and vagus nerve. So this all 3, 9th, 10th, 11th nerve also passes through the interjugular foramen. The anterior boundary we already discussed, it is formed by the most lower part, it is formed by the thin plate of the bone of the petrous part of temporal bone, which separates the internal carotid artery. Above to it there is a pharyngotympanic tube, and it is connected with the nasopharynx by the opening, it is called the interauditory meatus, and above to it there is a tensor tympani muscles. Posteriorly we already discussed, it is by the adductus to antrum and vertical part of the facial nerve. Roof, it is also we have removed. So roof, it is formed by the tegment tympani bone, it is the part of the petrous temporal bone, very thin plate which separates the ear. Inside there is a temporal lobe of the cerebrum. So this is about to the middle ear. Once again, this is a facial nerve, it goes posteriorly, and then here you can see this is the incus, this one is the malleus, and this handle of the malleus you can see it is attached to the tympanic membrane. So vibration, it led to there is a production of the sound. So this is about to the middle ear.